Hari Om, welcome to Yoga Vidya Gurukul, YogaPoint, Yoga Therapy Training Program. We will talk about diseases of digestive system. The digestive system is one of the important systems functioning in our body, and it is mainly related with the metabolic processes in our body. A disturbance in the digestive system can be the root cause of many diseases in our body. Disturbance of digestion, the improper functioning of digestion can also lead to dysfunction of the metabolic processes. So it is usually said that the origin of many diseases can be related with disturbance of digestion. And in a similar way, for the treatment of many diseases, it is very important that we focus on improving and rebalancing the digestive system. So whenever we are treating diseases, we need to give treatment for the disease in particular, but at the same time, we need to focus on improving the metabolism through improving the process of digestion. And when the process of digestion is improved, it will help the body's inherent capacity, the body's inherent energy to heal itself. So in the process of healing, digestive system has a major role to play. It is very important that we eat proper food. So when we say we have to eat proper food, the right food, it should also be consumed in a proper quantity. And also we should eat the food at a proper time. So the right food in the right quantity at the right time is the key for perfect health. The quality of the food should be nice, but at the same time, the quantity is also important. A good quality food, if consumed in large quantities, can be harmful to the body. Even a good quality food, if we eat at a wrong time, can be harmful for the body. So the right food in right quantity at the right time is important for our health. The symptoms which are related with the digestive system, of them, the first symptom is, of course, pain. Usually we say abdominal pain. And there are many points which are to be considered when we say it's an abdominal pain. It's important to note how the pain started, the onset, for how long there is pain in abdomen, the progress of the pain, whether it is increasing or decreasing, or it is the same, or it is episodic. Precisely where the pain is situated, is located in the abdomen. Also the character of the pain, whether it's a crampy pain, cramps in abdomen, whether it's a very dull pain, if it's a aching pain. So the character, the type of the pain is also important. And of course, how frequently, how periodically the pain comes and goes, or whether the pain is constant. All these factors, all these points need to be considered with the single symptom of pain in abdomen. And it is also important to note what factors increase or reduce the pain. For example, in some patients, eating food can increase the pain, but in others, eating food can relieve the pain. So while diagnosing or even while treating a patient with digestive disorders, digestive diseases, understanding the pain is very, very important. Nausea is another common symptom associated with digestive diseases, digestive system diseases. So nausea is actually a subjective feeling of discomfort, a sense of discomfort with an urging to throw out the contents of the stomach. This nausea may or may not be associated with vomiting. So it's a subjective feeling. And this nausea can also be associated with other symptoms like giddiness of head or heaviness of head, fainting, or even sweating along with nausea might be present. Vomiting is actually throwing out the contents of the stomach. Now, vomiting is usually associated with gastric disturbances, stomach disturbances, or the digestive system disturbances. But this vomiting may be related with other systems in our body, other diseases in our body, another conditions in our body. For example, excessive coughing, excessive accumulation of mucus in the chest, in the lungs, leading to coughing and then further leading to vomiting of that excessive mucus can be the reason of vomiting. Increased pressure around our brain is one of the reasons, critical reasons for vomiting. Accumulation of excess uric acid in the body because of metabolic disturbances can be the reason of vomiting. And of course, sometimes it can be hysterical. People having food disorders can purposefully vomit out the food. So it's important to note that vomiting is just not associated with the digestive system. It can be associated with other systems like the respiratory system or even the brain or metabolic processes, or it can be purely psychological, hysterical. Halitosis or bad breath is another symptom which can be associated with digestive problems, digestive diseases. But the reasons for having bad breath, halitosis, it may not be only the digestive system. It can be infections of gums or tooth decay. It can be improper oral hygiene. Sometimes people having sinusitis or tonsillitis, they can also have bad breath. Or there is a condition where no saliva is secreted in the mouth. People having dry mouth, they can also have halitosis or bad breath. Next, hiccups. Now, this is actually a symptom which is related with the abrupt contraction of the respiratory muscle, the diaphragm. So, actually, it's a symptom of the respiratory system. But then, the gases which are trapped in the stomach, in the digestive system, they are thrown out because of this abrupt contraction of the diaphragm. And so, it is also included in the digestive disorder symptoms. But the main reason for hiccups is actually the irritation of the diaphragm, the irritation of the respiratory muscle, which causes an abrupt, uncontrolled contraction of the respiratory muscle, the diaphragm. And as the pressure is created in the abdomen, the air from the stomach, or sometimes even small amount of stomach contents, may be coming out. That's called as hiccups. And the irritation, the reason for the irritation of the diaphragm, it can be anything from ranging from alcohol to abscess, like some drink, not necessarily alcohol, can stimulate excessive cold, excessive hot drink can stimulate hiccups or abscesses in the abdominal area, suppuration, accumulation of pus in the abdominal area causing an irritation of the diaphragm can cause hiccups. So actually there is no known reason for this hiccups, but then it's definitely an irritation of the diaphragm. Heartburn is another symptom. The word is heartburn, but it's not actually burning of the heart. It is the burning behind the sternum, burning in the chest because of the regurgitation of the stomach contents, and it will cause burning in the esophagus. The word is heartburn. And sometimes this regurgitation of food can be even with the smell and taste. of the food or the stomach contains, which can be felt in the throat. Belching is the air which is swallowed while eating or drinking water, drinking liquids. It is fermented in our stomach along with the food, the fermentation of the food in our stomach, or simply the air which we swallow is being thrown out. That's called as belching. It may or may not be associated with the smell of food what you have consumed. Flatulence is another symptom again related with air which is coming out of the rectum. So basically, if the hydrogen and methane which is normally produced by the intestinal bacteria, if it is produced in excess, then excess amount of air would come out of the rectum, which is called as flatulence. In some cases, this flatulence is also caused because of excessive secretion of hydrochloric acid in our stomach. So flatulence is passage of air through the rectum, movement of the air in the downward direction in the digestive system. Regurgitation of food is another symptom of digestive disorders. The stomach contents, they are pushed upwards and you can feel the liquid, you can feel the food in your throat. So regurgitation of food, the contents of stomach coming up to your throat. It's not actually throwing out the food substances. It is not actually vomiting. It's just the food comes up to your throat and again goes back to your stomach. Regurgitation. And then the reasons for that can be the problems with the motility, the movements of our digestive system, or it can be excessive fermentation of the food in our stomach. Of course, the most commonest can be eating food in excess, eating food more than required, or you eat the food, the quantity of food is less, but if you are continuously stimulating your taste buds, every off and on, every now and then, if the taste buds are stimulated, it will increase the digestive activity and disturb the mobility, the motility of the digestive tract, which can cause regurgitation. And there can be psychological and a physical reason for regurgitation, and that's churning of air with food. If you don't chew the food properly, if you don't swallow the food properly, if you are in a hurry of eating the food, along with the food, you will trap some air, more amount of air, which will be swallowed with the food, and that air will be churned with the food, and then it would be thrown out as regurgitation. Indigestion in itself cannot be considered as a disease as such of the digestive system, but it cannot be considered as just even one single symptom of the digestive system. And it's the most common disorder of the digestive system, which most of the people suffer. So in simple terms, indigestion means improper digestion of food, incomplete digestion of food. And the causes can be unknown causes and known causes. They can be physical causes, they can be psychological causes. So emotional disturbance or mental disturbance, psychological disturbance can also be the reason, can be the cause of indigestion. Eating too much of food, eating in a hurry, eating under stress, not chewing the food properly, swallowing too much of air while eating in a hurry can be the causes of indigestion. As far as the food is concerned, refined food, too much of sugars, too much of oil, spicy food, and instant foods can be the reason of indigestion. Also, nowadays, we are obsessed with an idea of consuming lots of water, keeping our body hydrated. But then consuming too much of water, unnecessary consumption, can lead to diluting the digestive juices, which can lead to indigestion. So controlling the water intake, especially during consuming your food, is also very important. Then irregularity of the food, no fixed timings to eat the food. Because if the timing of the food is not mixed, then the digestive juices will not be secreted on time and the digestion would not be proper. The digestion would not be complete. So these are a few causes which can lead to indigestion. Now, a chronic indigestion can lead to heartburn. It can lead to heaviness in stomach, irregularity of the bowel movements. And then these symptoms, they are associated with the digestive system. But apart from the digestive system, there can be irritability, there can be lethargy, there can be weakness, general prostration. Even symptoms like headache and fever may come up with chronic indigestion. And over a period of time, it can lead to weight loss and deficiency disorders because the food is not digested and the food would not be absorbed properly. Next condition of the digestive system is constipation. Now, as such, there is no specific definition of constipation. But then we can say those people who are not satisfied with their bowel movements are the people who are suffering from constipation. Now, as far as the causes are concerned, the first and the most important cause can be mental constipation, psychological disturbances, emotional disturbances, even slight changes in lifestyle, slight changes in the daily routine can lead to constipation. For example, traveling. Many people suffer from constipation when they are traveling. So it's a mental cause. In many people, they neglect the nature's call. Maybe they are too busy with their work and they just neglect They just dishonor the nature's call. And if this goes on for a few days, a few months, over a period of time, the nerve reflexes diminish and it can lead to constipation. So it's a constipation related with the nerve reflex nervous system. Another reason can be improper muscular activity, improper muscular movements of the small and large intestine. So it's the deficiency of the muscles to work in a proper way, which can lead to constipation. Food also can be the reason of constipation. Improper food, sticky food, too much refined food, food which would stick to the insides of the small intestine. Even though the muscles are strong, the food is so sticky that it would remain sticking from inside of the small intestine, leading to constipation. So the reasons of constipation can be related with the mind, they can be related with the nervous system, they can be related with the muscular strength, the muscular activity of the intestines, and they can also be related with improper food consumption. Like sticky food with lack of fibers, we need enough fibers in our food, which would help the bowel movements. And the last reason, the last cause for constipation is overuse of laxatives and purgatives, unnecessary overuse of medication to empty your bowels over a period of time can make our small and large intestines lazy, and we would start depending on the medication, the laxatives and the purgatives for the bowel movements. What are the effects of constipation? As such, there are no effects specifically. There can be abdominal discomfort, maybe there is body ache, there can be passing of flatus, can be belching, heaviness of head, or it can be even nausea. Some people are developing a condition which is called as bowel neurosis. Like if the bowels are not empty, continuously the thought of emptying the bowels comes in the mind. Insecurity comes in the mind, which is called as bowel neurosis. And this can increase the misery and anxiety in one's life if they are having constant insecurity about the bowel movements, constant thought of having the bowel movements all throughout the day. But then this constipation can lead to origin of other disorders of the digestive system. Another condition opposite of constipation would be diarrhea. Increased frequency of stools, increased frequency of bowel movements is called as diarrhea. And the quantity of the stools can also increase, and the consistency of the stools can also increase. Like more of liquid stools is usually an indication of diarrhea. The quantity, the consistency, and the frequency of stools is disturbed, and this is what is called as diarrhea. Another term, dysentery, it means loose stools, but it has blood and mucus in it. Diarrhea usually would not have any blood in it. When it's blood in the stools, it is called as dysentery. The reasons for diarrhea can be changes in the osmotic pressure inside the small intestine, electrolyte imbalance. So this electrolyte imbalance in the small intestine can lead to diarrhea, called as osmotic diarrhea. Then there would be secretory diarrhea, where the water is secreted inside the small and large intestines. The water from the blood flows inside the small and large intestines, increasing the quantity of water in the stools, leading to watery stools. Then there can be some infection, infection of the mucosa, or even injury of the mucosa. So to wash out this infection, the frequency of the stools is increased. The stools, they become watery, so that the infection, the infectious organism is washed out of the body. So this would be the diarrhea because of infections. And another mechanism is the altered motility, because mostly of psychological problems, emotional disturbances, psychosomatic effects, which would have the motility increased in frequency, leading to diarrhea. So the mechanisms can be related with the electrolyte imbalance, the salt imbalance. It can be related with secretion of water in the small intestine. It can be because of infections, or because of alteration in the motility, in the movements of the intestines. Gastritis. Gaster is stomach, and itis is inflammation. So in short, gastritis is the inflammation of the stomach, specifically the mucosa of the stomach. Inflammation is called as gastritis. The causes of gastritis are multiple. It can be alcohol, it can be tobacco, it can be steroids, consumption of too much of steroids, or anti-inflammatory drugs, anti-inflammatory medicines, painkillers. Excessive consumption can lead to gastritis. Excessive stress can be the reason of gastritis. Eating too much of chilies, too much of spicy food, too much of oily food, too much of hot food can be the reason for gastritis. And one reason is the presence of Helicobacter pylori. It's an organism which is usually found in the stomach, but if it is in too much of quantity, in large proportion, in large number, it can cause gastritis. The symptoms are usually a pain in the upper abdominal area, just below the sternum. It's a constant pain, steady pain just below the sternum, and it is especially more after consuming food, immediately after consuming food. There is tenderness whenever the patient touches just below the sternum. He can feel the pain, and interestingly, there would be no pain if the food is not consumed. So this is very typical of gastritis. If it's a severe case of gastritis, there can be hematemesis. It means blood in vomiting. Or there can be another symptom which is called as melena, which means blood in the stools. So hematemesis and melena can be two symptoms associated with gastritis in extreme conditions. Now, this gastritis over a long period of time, if this inflammation of the stomach mucosa is not taken care of, it can convert into ulceration, which is called as peptic ulcer. So it is the ulceration of the mucosa because of coming in contact with the acid, the hydrochloric acid, and the pepsin, which is secreted in the digestive system. Now, here a quick recap of the layers of the digestive system. So, the innermost layer of the digestive system is the mucosa. Just below that is the submucosa layer. Below the submucosa layer is the muscle layer, and the outermost layer is the serosa, which is a protective layer of the digestive system. Now, the mucosa, it protects the submucosa and the muscle layer from coming in contact with the acid, the digestive enzymes, and the pepsin, which is secreted in the digestive system. So, mucosa is actually a protection of the submucosa and the muscle layer. Now, in gastritis and also in ulceration, this mucosa, it becomes thinner, and then the acid comes in contact with the submucosa, causing gastritis, or if uncontrolled, leading to ulcerations. And these ulcers, they can even penetrate to the muscle layer and even can burst open outside the serosa layer. So basically, it depends on how deep the ulceration goes, from the submucosa to the muscle layer and the serosa, and forms a penetration in the digestive system, or it would be called as perforation. Here we can see a diagrammatic representation of the ulceration. So excessive acidic secretion in the digestive system can lead to damage of the mucosa layer, and it can cause ulcerations in the submucosa or even the muscular layer. Now, what are the causes of ulcerations, peptic ulcerations? Usually, it is considered to be hereditary in many cases. Familial tendencies are quite possible. And the next main reason is the mental tension, mental stress, worry, anxiety, anger, irritability. All these reasons can cause excess secretion of acid in the stomach, leading to first gastritis and later on ulcerations. Too much consumption of stimulants like alcohol, tobacco, smoking, tea and coffee in large quantities and frequently can lead to ulcerations. Another main reason is the food, highly seasoned spicy food, chili food, hot food with lots of spices can actually burn the mucosa of the stomach, leading to ulcer formation in the digestive area, the digestive system. Further on, The causes can be steroids, unnecessary consumption of steroids, too much consumption of steroids. Then non-steroidal anti-inflammatory drugs, painkillers can be the reason of ulcerations in the digestive system. Late night working, especially after 12 midnight, if you are working late night, it causes excess acid secretion in the digestive system, which can lead to ulcerations. We already mentioned about anxiety, fear, stress factors, mental factors, emotional factors leading to ulcerations. And lastly, it's observed statistically that people having blood group O have more tendency of developing ulceration, peptic ulceration, and even gastritis. Now here is a comparison of the harmful factors and protective factors for peptic ulcers. So the harmful factors are excess parietal cells. These are the cells which secrete excess acid in the stomach. So excess hydrochloric acid, excess pepsin, the digestive enzyme, excess secretion of bile acids, and the presence of Helicobacter pylori organism in the stomach can be the harmful factors. On the other hand, the protective factors would be bicarbonate secretion or alkaline secretion in the stomach, more amount of mucus secretion or the mucosal layer secretion, improved blood flow, blood circulation to the digestive system can prevent from peptic ulceration, and rapid formation of the mucosal cells or the mucosal layer can help protect against the peptic ulcers. Now, the signs and symptoms of peptic ulceration would be related with excess acid secretion. So it's burning, definitely burning in the stomach, burning behind the sternum. It's always a discomfort, always a dull aching pain with a feeling of fullness in the stomach and heartburn. The typical burning would be just below the sternum and behind the sternum or the chest bone. Now these ulcerations, depending on their site, depending on their position, they can be of two types. If the ulcers are in the stomach, they're called as gastric ulcers, or if the ulcers are in the duodenum, the first part of the small intestine, it is called as the duodenal ulcer. Now the pain in gastric ulcer is usually just below the sternum, and this pain, it comes up immediately after food. So the person having gastric ulcer is actually afraid of eating and he would want to avoid eating. As against, the pain in duodenal ulcer would be in the center of the abdomen, and it would come after a few hours of consuming food. So when the food enters into the duodenum, maybe after 2 or 3 hours of eating, then the pain will start. But actually, the person who is suffering from duodenal ulcers feels better by eating food. So a person having duodenal ulcer would actually eat more and maybe put on weight. As against a person having gastric ulcer is afraid of eating, would eat less and maybe would lose weight over a period of time. So, as we were mentioning, the gastric ulcer, appetite is reduced, there is weight loss, and there can be vomiting and blood in that vomiting. And the gastric ulcer patient is better by bland diet, no spices, no salt, plain diet, usually sweet, and he's always better by alkaline food or like milk. In duodenal ulcer, the appetite is increased, so there can be weight gain. Usually there is no vomiting, there is no blood, no vomiting, but then there can be black stools, which indicates blood in the stools. And these duodenal ulcer patients, they are better by any kind of food. They would eat and gain weight. Now the complications of ulcerations, peptic ulceration, it can be gastric ulcer or it can be duodenal ulcer. It's an ulceration, so if the ulcer doesn't heal, there would be constant blood loss, which can lead to anemia. Unhealing ulcers can lead to scarring, scar formation, and the mucosa will lose its elasticity and become hard. There can be perforations, like from the submucosal layer to the muscular layer, and from the muscular layer to the serosal layer, and the ulcer bursts open, leading to perforation at that site, a hole at that site. And if the ulcer is perforated, it would lead to a condition called as peritonitis, or in general term, for general understanding, we can say the inflammation of the abdomen, which is an emergency situation. The pain is unbearable, even in perforations, and also in peritonitis, the pain would be unbearable. It's a condition where the person needs to be taken to the hospital and needs a surgical intervention. So these can be the complications of peptic ulcer. Depending on the site, it can be the gastric ulceration or it can be the duodenal ulceration. Continuing further with the ulcerations of the digestive system, we will talk about ulcerative colitis. Now, this is again the ulceration of the digestive system, but this ulceration is in the colon, in the large intestine, and the condition is called as ulcerative colitis. Now, there are no specific reasons known for ulcerative colitis, but then some of the known causes are infections like the E. coli or Campylobacter or even the Mycobacteria. So some infections, some severe infections, long duration infection by these organisms can lead to ulcerative colitis. Many times it is said that it's an autoimmune disease. So there are antibodies formed against the large intestine and it leads to damage of the large intestine, ulceration of the large intestine. So it is also considered as an autoimmune disease. Some say that it is allergic reaction to some specific food. Then it can also be a disturbance in the motility, in the movement of the large intestine involving the muscles, or it can be purely psychosomatic, psychological. But then, as yet, no very specific cause for this ulcerative colitis has been documented. Now, as you can see here, the large intestine is involved in ulcerative colitis. So it's an ulceration. So the ulceration, it can be limited to a part of the large intestine, or the complete large intestine can be involved. So only the rectum can be involved, as shown in number 1, or it can be the sigmoid colon, as shown in number 2, or it can be the descending colon, as in the third one, or it can be the involvement of the complete large intestine, as shown in number 4. So the severity of the disease will also depend on the amount of the colon, the amount of large intestine involved in the disease. As it's an inflammation, ulceration of the colon, the large intestine, there can be diarrhea, and this diarrhea can be continuous or it can be episodic, and usually it is with blood and mucus because it's an ulceration of the colon. Now, as it's ulceration over the colon, there is tenderness. If you touch that part of the colon over the abdomen, there would be pain. So this is called as tenderness over the region, over the area of the colon. And there can be scarring, there can be perforations, there can be tightening stricture of the colon, which further complicates the thing. This scarring and stricture, the elasticity of the colon would be reduced, which would further interfere in the bowel movements and which can further lead to bleeding and diarrhea. The main function of the large intestine is water balance, absorption of water. So as the intestine is involved, the large intestine is involved, the absorption of water would be reduced. As there is bleeding, too much of bleeding, it can lead to anemia. There is improper absorption, so it can lead to deficiency signs and symptoms. And of course, all these things can lead to weight loss. All the time, the patient would have abdominal discomfort, and usually there is an urgency and very intense, unbearable abdominal colicky pain, and the patient wants to pass the stools. Now these symptoms, they would develop over a period of time and they would remain for a very long duration of time, leading to all the further complications like the deficiencies, the anemia, weight loss, and other things. So it's a chronic involvement, chronic ulceration of the large intestine. And because of the pain, because of the unbearable abdominal colicky pain and urgency to pass the stool, the daily activity of these patients would also be disturbed. As far as the complications of ulcerative colitis are concerned, They would be more or less similar, like the ulcerations, the peptic ulcerations, the gastric and the duodenal ulcerations. So there can be perforations, there can be formation of fistula or connection between the large intestine and the vagina in women may develop. There can be abscess formation, and in very severe conditions, there can be changes leading to cancer development. We will now talk about irritable bowel syndrome, in short, IBS. Now, this condition is related with the bowel, the large intestine, and this is a functional disorder, a functional problem, which causes either diarrhea and or constipation. So the clinical picture would be diarrhea or constipation with irregular, uncoordinated movements of the large intestine. So there is altered muscle tone, there is no coordination in the movements of the large intestine, there is irregularity, and very importantly, as mentioned earlier, it's purely a functional disorder with no structural changes. Now, this irregularity, this uncoordinated movements of the bowels can be triggered by any of the causes which are mentioned here. So, the causes for irritable bowel syndrome can be sensitivity of the digestive system, and this sensitivity can be inherited. Then some people can be sensitive for certain kind of food, certain kind of diet. Exposure to this kind of food can lead to the sensitivity, can lead to irritable bowel syndrome. Sometimes some infections like amoebic infections or bacterial infections are also blamed for causing irritable bowel syndrome. Also, unnecessary use of laxatives, purgatives, or excessive use of antibiotics, changing the bacterial flora in the large intestine, is sometimes considered as a reason for irritable bowel syndrome. And as always, anywhere and everywhere, emotional problems, stress, tension, worry, anxiety, all these conditions can trigger IBS. Now, usually this condition is usually seen in middle-aged people, and it's more common in women. Now, there is periodic diarrhea or constipation, or there is an alteration between diarrhea and constipation. But it's interesting to note that the symptoms, especially of diarrhea, they are always when the person is awake. The diarrhea is painless, absolutely no pain, but it's very urgent. The control over the movements is more or less lost. The diarrhea usually comes up, as I said, when the person is awake. Usually it would be triggered while the person is eating or immediately after eating. But it is very well observed that there is no diarrhea in these patients during sleep. So this is an indication that somehow maybe this disease is related with the mind. It's a psychosomatic disease. Now, clinically, the person may complain of fullness or heaviness, or in rare cases, may complain of pain. There is excessive accumulation of gases in the abdomen, leading to flatulence, flatus with diarrhea. So, air coming out along with diarrhea. And this continuous symptoms of diarrhea can lead to weakness, can lead to deficiencies, can lead to nervousness because of abdominal insecurities. It will have an impact on the person's day-to-day life. Coming to another condition of the large intestines, to be particularly with the rectum, the anal canal, is hemorrhoids. In common man's language, piles. So hemorrhoids is actually the accumulation of venous blood in and around the rectum and the anal canal. Sometimes excessive constipation can be the cause, can be the reason leading to hemorrhoids. People suffering from constipation can develop hemorrhoids. Lack of muscle tone in the rectal area, in the anal area, and also relaxed perineal muscles can be the causes which can lead to hemorrhoids. Also, sometimes during pregnancy, the pregnant mother may develop hemorrhoids. Now, usually the hemorrhoids, they are classified as internal and external hemorrhoids. But more than this important is the degree of the hemorrhoids, the degree of the prolapse of the hemorrhoids. So the first degree hemorrhoids, they are very small and they are located only in the anal canal. The second degree hemorrhoids, they are also very small in the anal canal, but they are prolapsed with the passage of stools and they come back again in the anal canal without any efforts. The third degree hemorrhoids are prolapsed during stools while passing the stools during bowel movements, and they need to be replaced manually back to the place, or they need to be manually pushed inside the anal canal after the passage of stools. And the fourth degree hemorrhoids, they remain always prolapsed and cannot be replaced back in the anal canal. So a small part of it, small part of the hemorrhoids, it keeps prolapsed, it keeps projecting out of the anal canal and cannot be replaced back. Here you can see the first degree hemorrhoids. As mentioned, they are inside the anal canal. The second grade, they are also inside the anal canal, but they would prolapse with the passing stools and then they would get inside automatically. In grade 3 or third degree, they would not be replaced automatically, but manually have to push in the hemorrhoids in the anal canal. And the last degree, the fourth grade, fourth degree, a small part of it will continuously keep popping out, prolapsed outside the rectal canal. As far as the signs and symptoms of hemorrhoids are concerned, it would start being asymptomatic when it is very small, but then usually the complaints start with unsatisfied, not completely done complaint of the bowel movements. Constipation can be the reason of hemorrhoid, can be the cause of hemorrhoids, and it is also the effect of hemorrhoids. So these people would be constipated. There can be sensation of something in the anal canal. Of course, with this sensation, there can be pain, there can be swelling, there can be burning. In some cases, it can be even itching. And with hard stools, there would be bleeding through the rectum, and this blood is bright red blood because of the injury caused by the hard stools. And usually this bright red blood is over the stools and it is not mixed with the stools. So it's a fresh bleed every time the person passes stools, and then there would be pain before, during, or after stools. And in complicated conditions after the fourth grade, the fourth degree of hemorrhoids, these hemorrhoids may get ulcerated, or even there would be thrombosis in these piles, in these hemorrhoids. In the end, we will talk about one more condition, malabsorption syndrome. So basically, it's related with defective digestion, defective absorption of food, leading to weakness and deficiency signs. Now, this defective digestion can be because of lack of some bile salt secretion, or it can be related with some pancreatic diseases. Also, there can be infections in the digestive system, long duration infection, chronic infections because of unhygienic conditions. And then there can be sometimes a developmental defect of the villi or the mucosa layer in the intestines, and maybe this is because of again a very chronic infection. Mostly a constant infection in the intestines is considered the cause of malabsorption syndrome. And clinically, as it's a malabsorption, so there would be diarrhea and weakness, there would be weight loss, there would be general weakness, lethargy. As it's an infection, the stools would be bulky, there would be frothy stools with a lot of foul smelling, then there would be flatus, distension of abdomen, and fats would be seen in the stools. So basically, it is improper absorption, improper digestion of the food which is consumed. And because of all these things, there would be deficiency signs and symptoms. There can be deficiency of essential elements. There can be deficiency of iron leading to anemia. There can be deficiency of vitamins. But then a very specific reason is not known for this apart from infection and some problems with the pancreas or the problems with bile salts. No specific reason for this malabsorption syndrome is very well known. So in short, this was about the main diseases, the main conditions, the main problems of the digestive system. And we stop here. Hari Om.